Enterococcus faecium is a bacteria that lives in the gut of humans typically. While previously was associated with gut health, it's changed in a way, and now we consider it an organism that's endemic in hospitals and infects the sickest patients in hospital environments.
Faecium is a highly drug-resistant pathogen, and so that's often what people are thinking about in the context of faecium infection.
So a lot of the patients that we have in the hospital are colonized with strains of faecium that can actually end up causing bad infections.
We were interested in mechanisms that bacteria could quickly evolve to the hospital environment. We know from lots of studies that one common mechanism that bacteria can evolve quickly is by jumping genes.
Jumping genes are genes that encode an enzyme that enables that piece of DNA to be cut out of the DNA, moved, and then pasted in somewhere else.
And so what we did is we looked at the organisms, the bacteria that are really commonly infecting patients in hospitals. And we looked for signatures of these jumping genes moving around on short time scales. And the organism that we found this to be most prevalent in was Enterococcus faecium.
Our patients who have cancer are often exposed to chemotherapy, and this can kill a lot of the healthy, normal bacteria within people's guts.
They are very vulnerable to infection because their immune system is wiped out and then reconstituted. One of the patients that we studied in detail was a patient here at Stanford who received a hematopoietic cell transplant. During the peri-transplant period, we saw that Enterococcus faecium was what we call dominating their gut. It was the last survivor in the gut of this patient. We had a stool sample from that patient every week. We watched mutations that occurred in that Enterococcus faecium that was in that patient's gut increase in frequency. And by a month into their transplant, this mutation was in the entire population of Enterococcus faecium, which signaled to us that this was an important mutation and was helping Enterococcus faecium in that patient's gut survive and cause infection.
We weren't really expecting faecium to be evolving so frequently and so quickly during infections.
One of the things that we've noticed over the course of my clinical training is that at that time, faecium was a rare cause of fatal infections in hospitalized patients. If we fast forward to today, faecium is a major and very feared infection in the hospital setting. In this particular paper, what we found was that faecium seems to be evolving very rapidly during that time frame from 1998 to 2025 through the process of the movement of jumping genes.
We don't really know how that jumping gene activity started, and we don't really know where it's going in the future. So we don't know if faecium is going to continue to evolve to become more specialized to the hospital environment, cause more severe infections, and how it uses jumping genes to do that.
Figuring out why this jumping gene has been successful would maybe give us some insight as to how to stop this jumping gene from moving around, and maybe give us insight into how to regulate or prevent these jumping genes from helping not only faecium, but other bugs.
This provides a framework in which to think about how we might be able to stop faecium from growing to infest that entire colonic niche, and thereby also prevent it from translocating into the bloodstream and causing infections in our patients.